So while the primary focus of this lecture has been on HIV/AIDS, I want to talk about some of the other diseases that go hand in hand with HIV/AIDS and drastically affect communities that have a large HIV/AIDS population. Tuberculosis is one of those diseases, and just to give you a few statistics on the slide, TB, as it's commonly known, is a leading cause of death for people living with HIV in low and middle income countries. Although tuberculosis has decreased globally in recent years, the number of cases has continued to rise and increase in areas that are heavily affected by HIV. And one of the reasons is that there's an emergence of a drug-resistant form of TB that's emerging in these communities. Although malaria death is a close second, I want to focus first on tuberculosis and walk you through that disease and the common co-infection that occurs, particularly in places like sub-Saharan Africa. Going back to the statistics, the World Health Organization estimates that about 22% of TB cases in Africa occur in people living with HIV. And in some countries on the continent, this figure is as high as 70%. And one of the reasons that there tends to be a co-infection of HIV and TB is that when you have HIV, as you'll see if you read the supplemental information that I pointed you to in the last segment, is that HIV affects one's immune system, and so that as your immune system is depressed by the spread of the virus, you become more susceptible to diseases. And tuberculosis, once a tuberculosis outbreak has started in a place, is a very contagious disease, and it spreads very rapidly through a population. TB patients with HIV typically have been shown to be twice as likely to have the drug-resistant form of HIV, which is known as MDR-TB, as people who are not HIV positive. So again, not only are they more susceptible to get the disease, they're also more susceptible to get the rarer forms of the disease. And this hits quite home, quite honestly. My children are adopted from Ethiopia, and one of my children is a TB patient, and in the orphanage contracted the disease. And there's potential lifelong ramifications. TB affects your lungs, and the long-term implications of the disease are scarred lungs and a decreased lung capacity. So if you think about some of the other diseases we've talked about that are linked to malnutrition, such as anemia, where you have low iron levels, what iron serves in the blood to do is to help oxygen. It anneals to what's called your hemoglobin, and then your oxygen sticks to your hemoglobin, and that's what makes your blue blood that doesn't have oxygen, once it passes through your lungs, the iron helps the oxygen stick to your blood, and that's what turns your blue blood into red blood. And so if you think about the implications of anemia, basically it means that your blood is not getting the amount of oxygen that it needs on a very basic chemical level. So then if you compound a disease like anemia with a disease like tuberculosis, where you're getting scarring on your lungs and you have a decreased lung capacity, you're getting even not only less oxygen from the anemia, but even less because of the TB. Side effects of this include things like listlessness, tiredness. You might be more susceptible to disease because your immune system will be depressed because of the lack of oxygen. So you can very easily, I think, and quickly see how these diseases tend to add up and snowball in their effects on an individual. So just the TB and anemia alone will cause you to be ill, and then you add on that a disease like HIV, where your immune system gets depressed, and literally you're in a situation where the cards are drastically stacked against you in terms of being able to maintain health for a long period of time. Going back to some more statistics about TB, despite the availability of affordable treatments, only about 32% of TB cases in people living with HIV received both the antiretrovirals needed for treatment of the HIV and also the anti-TB drugs. And again, going back to the statistics, as I mentioned earlier, there's an increase when there's a place where there's an increase in HIV infection rate, there tends to also be an increase in TB. And so if you're only treating one of the two diseases, you're not maintaining the ability of that individual to function well. And so looking at dual treatment options, especially in places like sub-Saharan Africa, are a must if we're going to solve this health issue that these people are facing. We also need to look at the role that food support plays in enabling people to compete for the full course of treatment. A lot of antiretrovirals require food in order to work appropriately. And so individuals who aren't able to eat or don't have access to a consistent supply of food, the drugs that they're taking may or may not be doing them any good because it's not coming in at the right time with the right nutrients, and so their body isn't able to absorb the drugs and treat the disease. This is an example of a patient in Africa. I'm not sure exactly which country, but this is a patient who's HIV positive and has also contracted tuberculosis. And as you can see, it's a very dramatic situation. This was taken in March of 2003. But fortunately, this patient was able to receive the health care that he needed and also get both the antiretrovirals and the anti-TB drugs. And this is that same individual 6 months later. So you can see that with treatment availability, you can overcome this disease and you can live in a healthy way with these diseases. But it's very, very, very important that not just one problem is being treated, that the person is being nourished and then also being getting the drugs for each disease that they have. I want to take a brief minute and switch gears, and I'd like to switch to malaria. For those of you who don't know, malaria is a disease that travels through mosquitoes. A mosquito net is typically enough. There are anti-malarials out there, but if you sleep under a mosquito net, it's typically enough. A mosquito net costs in the ballpark of about $10. But I want to show you this image because this is of a malnourished child in Uganda who also contracted malaria. And because of the compound between malnourishment and malaria, when this child got sick, she was actually a fairly happy, healthy, young 7-year-old girl. But once she contracted the disease, it didn't kill her, but you can obviously see it drastically affected her health. She went through several rounds of the disease and then also had a lot of mental complications because she wasn't getting the oxygen to her brain. But she was able to get to a malnourishment center, and this is that same child several weeks later after some refeeding programs. But it's important to note that although this bout with malaria didn't kill this child, it very severely impacted her future and her ability to participate in her society. She now has a lot of mental issues that she may or may not overcome. And so it's important to note that these diseases, although we've been sharing a lot of very large statistics and millions of people and X% of this population, it's important, I think, to remember that these are people that we're talking about, and these people have faces and names. And so it's important to always, when you're in this line of work, to bring it back to home base and realize that these are people and these are real stories, but they also have real solutions.